Hear me now? And thank you in particular to Congresswoman Sanchez, who's been such a strong supporter of the medical marijuana patients who are suffering in California. I'm Rob Kampia. I'm the Executive Director of the Marijuana Policy Project, which is the largest marijuana policy reform organization in the United States. There's been ample research that shows that marijuana is both safe and effective. It's safer than most prescription medicines, it's safer than aspirin, and it's certainly medically efficacious. Patients with MS, AIDS, cancer, chronic pain have all benefited from marijuana. And the Institute of Medicine, of course, reviewed all of that 5 years ago now for the Congress and for the drug czar. That said, I will admit that there are insufficient studies to prove to the FDA that marijuana should be approved as a prescription medicine, and there's political reasons for this. One is that the Department of Health and Human Services issued guidelines which makes it more difficult to research marijuana than to research any other drug on the planet. It's more difficult to research marijuana than ecstasy, LSD, or any newly developed pharmaceutical. So that has a chilling effect on research. In addition, the DEA has been obstructionist again. Currently, the University of Massachusetts is trying to get DEA permission to grow privately grown, privately funded marijuana up in Massachusetts for the purpose of studying it. And after 3 years of waiting, the DEA still has not given them an answer. And so consequently, because there's no private source of marijuana in this country, no private sector industry is actually going to go and try to spend money, because you can't get a privately produced drug approved by the FDA if you can't get a hold of a drug. So there's a big political problem, and because of this, it could be years, if ever, before the FDA would approve marijuana as a prescription medicine. Now, this hearing purports to be about science, and yet I find that hard to believe. This Congress in general, and the chairman in particular, are not exactly bound by science in their statements. To give you some examples, Chairman Sauter here criticized the state medical marijuana laws today as if it's some new discovery. Yet a couple of years ago, he asked the GAO to do a comprehensive study of what's going on in the medical marijuana states. And I just read this last night again, and I say this study came down on our side. You must not have liked it. Perhaps you didn't read it. But most of the laws are working just fine. Most of the patients are not abusing. The vast majority of the doctors are not abusing. And in fact, GAO said that only 1 to 3% of the physicians were recommending medical marijuana in these states. And those who are recommending, 82% of these physicians made only 1 or 2 recommendations. So the vast majority of the people who are actually abiding by the program correctly, and yet in your scientific inquiry, you invited Dr. Levesque, who is literally the only physician in Oregon to have written an inordinate number of recommendations. It seems highly biased. 2, you wonder what impact medical marijuana has on these patients, given that it hasn't gone through the FDA. But yet you didn't invite any patients to speak today. You could have invited Richard Brookhiser, the senior editor of the National Review, who could have told you about his medical marijuana use. You could have invited Lynn Nossiter from the Reagan administration, who would have told you about his daughter's use. The federal government is currently mailing marijuana regularly to 7 patients across the country, and yet those 7 patients who are currently legally using the federal government's marijuana, they were not invited to testify. Yet another example is on the House floor a year ago. You said, Mr. Chairman, quote, "It does not help sick people. There are no generally recognized health benefits to smoking marijuana." It is generally recognized. The American Nurses Association, the American Public Health Association, the American Academy of Family Physicians, and dozens and dozens and dozens of other organizations recognize marijuana's medical value. This information is in the written testimony I provided. So what you said on the House floor was false. Also on the House floor, you said that you met with officials from the Netherlands, and they said, supposedly to you, that they rejected the use of smoked marijuana for so-called medical purposes. I don't believe you. Holland is currently allowing physicians to prescribe marijuana, and patients are currently picking it up at pharmacies. It hardly sounds to me like the Dutch oppose medical marijuana. Unfortunately, this is not a scientific issue, but a political issue, and therefore, because of the obstruction of science, we are moving forward politically. And we're going to keep passing state bills and state initiatives until a majority of the states cry out to the federal government to fix the federal problem. In closing, I want to quote the DEA's own administrative law judge in 1988. He said, quote, "Marijuana in its natural form is one of the safest therapeutically active substances known. The provisions of the Controlled Substances Act permit and require the transfer of marijuana from Schedule 1 to Schedule 2. It would be unreasonable, arbitrary, and capricious for DEA to continue to stand between those sufferers and the benefits of this substance. I agree with the DEA, and Mr. Souter, to the extent that you are not helping research go forward, and to the extent that you continue to oppose our legislative efforts, your position on medical marijuana is, in fact, as the DEA said, unreasonable, arbitrary, and capricious. Thank you.
I appreciate you for at least being consistently wrong.